Hi, this is Wendy Briggs with Hygiene Diamonds. Yesterday I filmed a short video about why perio profitability is down in many practices across the country, and I had no idea what kind of response I was going to get. Obviously I hit on a pretty emotional trigger, and I wanted to kind of continue this process with you today. And I want to just take a few minutes and describe what I think the ideal perio practice should look like and what's happening in a lot of offices that are experiencing good success with perio. Most experts out there would suggest that about 30% of your new patients would need periotherapy of some kind. And if you really look at the numbers, what this means is if you have 60 new patients a month, you're doing more than 72 quadrants of perioscaling and root planing. Now, most offices, that's a very unrealistic number. We just don't do that many quadrants of scaling and root planing. But in my vision, an ideal practice has at least 20%, which would translate to 48 quadrants of scaling and root planing. So I think a healthy level, a reasonable expectation would be 20% of your new patients are enrolled into some level of periodontal therapy. Okay, now that's the ideal practice. This ideal perio practice also gets incredibly high case acceptance, probably higher than 90%, because they have the skills and the ability to translate the condition and the disease and the severity of the systemic risk involved with the periodontal infection into a language that the patient can understand and will choose to move forward with and can accept. The ideal practice also has streamlined procedures, can provide these periodontal services in a timely manner, efficient manner, without causing pain to the patient. The ideal practice also has state-of-the-art technology incorporated into their services. They may be utilizing a laser, a soft tissue laser. They may be doing blood testing, CRP testing, where they're testing the CRP levels in the blood before and after periotherapy. They may be providing DNA testing, as well as determining, using blood testing to determine the pathogens that are causing the infection. And they're treating the infection with a systematic approach, where they're looking more at all of the reasons the disease and the infection may be present. The ideal perio practice also is highly productive, and I would say usually a very profitable periodontal program is producing between $650 and $1,000 per appointment for perio. Okay, so there's a lot of really great things that are happening in a very successful periodontal practice, and hopefully, as we go through the next few days, we can help you understand what it takes to get there with your practice.